And welcome in. It's so good to see you. It's Josh Carey here for Energy Therapy News. Today we're joined by Mandy Dickey. She's a nurse practitioner at Minneapolis Clinic of Neurology. She's also the founder of Brain Wellness Solutions and also hosting the podcast under the same name, Brain Wellness Podcast. She's the one we want to speak to today. Mandy, good to have you. Welcome to the show.
Good to be here. Thanks for having me.
I want to start with your role, nurse practitioner, Minneapolis Clinic of Neurology. That sounds like a serious position. But what I love about this is we're going to talk about red light therapy as a useful and much needed tool in your tool belt. But let's back up for a minute. Who comes through the Clinic of Neurology where you work?
Yeah. As far as the general clinic, we see a little bit of everything, anything related to neurology, migraines, Parkinson's, MS, you name it. And they had been wanting to start a branch for concussion for many, many years, but they didn't have a provider that was really interested in doing that. And along came me after having my own brain injury. I had been a nurse practitioner for 12 years in neurology, and I had previously worked at that clinic as well, but mostly in the hospital. And I did a lot of stroke care, a little bit of concussion care as well, and then got in a car accident myself, had a brain injury, and was out of work for almost 2 years. And when I came back, or when I was getting ready to come back, the president of the company, who's my supervising physician, we had been friends and colleagues prior to this. And he said, we've been looking for a concussion provider, and when you're ready, we can make it happen. And we made it happen. So I've been building this concussion clinic and doing things very different because I do integrate all of the alternative / complementary therapies that many people don't know about.
Like what?
Like red light therapy, for example, PEMF, getting them into neurofeedback. There's a lot of things outside the traditional medical realm for treating somebody that's had a brain injury that a lot of providers just aren't aware of. They haven't had the experience, they don't have the knowledge. And a lot of them, if you ask if this will work, that they usually poo-poo it and say, it's probably not going to work. Take this medication for your symptoms instead.
How did you then come to embrace it? Was this behind closed doors for yourself? What was there?
Actually, it was personal experience. So one of the physicians I worked with had started a clinic here in the Twin Cities area using red light therapy after his own family experience with it. They got interested, started using it on themselves, their friends, and then opened this clinic with red light therapy, PEMF, transcranial laser therapy using the red light, and then exercise with oxygen therapy. All of these things were available at this clinic. And he called me up and he said, we need to get you back to work. I want you to come try it. And I was open-minded. I was willing to try anything at that point because I wasn't getting better from the traditional route. And from day one going in, I never was the same as I was prior to that first day. First day, I thought, if this is placebo, great, I'll take it because I need a win.
Yeah.
But I never went back to what I was. It was progressively getting better and better over the next 6 months of treatment.
What was getting better?
All of my concussion symptoms. So I had issues with balance, with my vision, with my speech for a good 6 months. I couldn't finish a sentence because I'd lose track of my thought in the middle of a sentence. And I'm a speaker. I had a podcast. I have this education that I do for the public, for my colleagues at work. I see patients all day long. I talk all the time. I'm one of those kids that got my name on the board all the time for talking as a child.
Me too.
And so for me not to be able to finish a sentence, it was devastating. And I couldn't remember what I was doing from one moment to the next. I'd go to a medical appointment, couldn't remember what happened at the appointment. So I couldn't tell my husband what happened, my family. I couldn't update anybody. And that first day when I went in, and all we did was the PEMF and the laser that day, I left being able to speak full sentences that day. I called 3 of my friends, told them what happened in the clinic, and they said, Mandy, my gosh, like you couldn't do this a day ago even. And I talked my child's ear off in the car, and he said, welcome back, which led to me writing a book about my first year of recovery, including all of these different things. But It was one after another person saying, welcome back, welcome back, welcome back, because I could speak, I could see better, I could tolerate my therapies, I could be with friends and family where I couldn't prior to them.
Why does it get such a bad rap when it seemingly works? You're smart, you're intelligent, you're gainfully employed, right? You have a
Yeah.
good employer, right? That
Yeah.
people are like, we're going to pay you for your service in our clinic, at our hospital. Like, come on. You're
Yeah.
right. So what's the deal?
I think people are scared of what they don't know. In medicine, we get taught books and books loads of information in school, and we go by that information. We know what we know, and we don't know what we don't know. And the things that we don't know about make us very uncomfortable in general, as a whole,
Mm.
all the providers in general. There are few here and there that are open-minded and they'll see things and they're like, I'm going to look into that a little bit more, and they're curious, and patients will ask them about things and they put their ego aside and they say, you know what, let me learn more about this. But so many people go into it, they get the degree and they're like, I got this education and I don't want you to tell me what to do. To be honest, not to be mean to my colleagues, but a lot of us are like that. And then we think that we've learned everything in school when the school just
Mm.
teaches us the tip of the iceberg. And I learned that from my own personal experience going through my own recovery. What I had learned in school and what I was dealing with my patients literally was just the tip of the iceberg. I knew to send them to PT, OT, speech, sure, do the traditional realm, but I didn't know about all these other options until I was in it myself.
So the idea of PEMF, pulsed electromagnetic frequency,
Mhm.
and red light therapy. What are you currently using in the clinic that you used yourself? Let's talk about the red light therapy. What is it? What does it look like? What does it do?
Yeah, so we don't use it in at my personal clinic. We use it at the clinics that I refer to, the
Yep.
place that I got my treatment. I worked there as a laser technician for a while before I was able to get back to being a nurse practitioner. So the red light comes in two different forms. It's either in a bed, so a red light bed, or via a laser, direct laser that goes to the site that you're focusing on. So whether it be musculoskeletal type of injury, we can use a laser that focuses on your shoulder to
Mm.
repair your shoulder, or we have a different laser that they use for the brain. And some places use a cap that has the laser frequencies in it, and then some places use a wand and wand over different areas of the brain depending on where your function is diminished.
Are these accessible outside of professional environments?
They do have cheap versions online, and I always say buyer beware
Mm.
because most of those the frequencies are not big enough to get through your skull. They're not big enough to get deep enough into the tissue to help you. Red light started as skin treatments, dermatology, and it works really well for skin. And it doesn't have to penetrate very far to get to the skin to cause improvements in your skin texture, get rid of fine lines and wrinkles, improve the elasticity of your skin. But if you want to go deeper, getting into the brain, getting into the tissues, you need a higher frequency, and those are medical grade. So you have to go to a medical facility to get that technology.
Let's talk about PEMF, for example. I may have told you this when we had our earlier conversation. I've gotten connected with the creator of this product called Vibe, and it's a PEMF device with like 50 plus menu options that are geared to target different things. I'm always open minded, but I was new to this and I'm like, yeah, let me give it a shot. I never let go of this thing. This thing that creates PEMF frequency. You play it 30 minutes. It sits in your pocket. You don't hear a thing. You don't feel a thing. And it seems to work well day in and day out. So I'm a fan.
Yeah.
What is your experience with PEMF day to day?
Yeah, so at the clinic where we had the red light and everything, we use the mats. So you laid on the mats to get the
Yeah.
PEMF that way. And some people use grounding mats at home, which is a very similar type of concept, but you can lay on it all night long versus the mats, you only need 15 to 30 minutes for most of them, like that little pocket machine as well. So PEMF what it is. We all might hear the terms EMF, electromagnetic frequencies. It comes from our TV, it comes from our computer, it comes out of our phone. Those EMFs can cause inflammation in our body.
Hmm.
The PEMF, that pulsed part of it, that gets us back to essentially the Earth's energy. So think about when we were little kids, we were outside running around barefoot in the grass and the dirt. Did we get sick very often? No, we didn't, because our immune system was kind of jiving with the Earth's energy. And we got that Earth's energy by being out there being barefoot. As adults, we're wearing shoes all the time. We're in concrete buildings. We're not getting outside. We don't get our feet in the grass and the dirt. And depending on where you live, it might not be possible year round. I'm in Minnesota, we've got snow. I don't go stand in the snow. But we're not getting that Earth's energy. So whether it's a pocket device or laying on a mat or laying on the mats on your bed for the nighttime mats. All of that helps to ground us and get us back to that Earth's energy. And that helps our body do what it's supposed to do. So there's no magic about it. It doesn't automatically fix everything that's wrong with us, but it realigns our cells in our body so that they can do what they are supposed to do, such as reducing inflammation, whether it's the brain or elsewhere in the body. I've seen patients have major skin conditions. They come in for one issue, but their skin condition goes away because it has reduced the inflammation in their skin. And if you sit on it when you have a headache, it can reduce the headache because it's reducing the inflammation as you're there.
Yeah, it's one of those things that correct me if I'm wrong, there's no side effects to any of this.
The only question is if somebody has like an implantable electronic device. So for those people, that might not be a great idea because there is a little bit of electrical frequency. You don't want to mess up those devices. But beyond that, no, there's no bad side effect. If anything, you might gain some energy and be a little bit happier. But those I don't see as side effects. I see those as bonuses. So
So you brought in if I heard this correctly, you created the concussion protocol for the clinic?
I have worked with them to create it, yes. So the devices that we used in that clinic, they came with all sorts of different settings. So we went through to figure out what would a good setting be for somebody with an acute concussion. So there's a 10 session protocol for that acute concussion. There's a 24 session protocol for somebody with a more moderate concussion. And there's a 6 month protocol for somebody with more severe injuries or neurological conditions such as what I had. And we kind of go through the different frequencies working with trying to heal your body from multiple different angles, not just the brain. There are frequencies specific to the brain. There are also frequencies specific to your immune system, Epstein-Barr, or all those different viruses. So you can do different frequencies depending on the machine that you use to treat multiple different areas.
And this is all in energy therapy category
Yeah.
with a very reputable clinic,
Mhm.
right? There's no one could dispute that. And yet, are people commenting from the outside looking in on what you're doing?
People are always skeptical. So I've had several of my colleagues ask, well, do those things really work? Why do they actually work? And I can say, well, I can tell you from my own personal experience, yes. And I just had a patient in follow-up this week that I referred out to again for laser treatment and the red light. And he had a severe brain injury and had significant symptoms that were limiting his day-to-day activity. He couldn't come in without sunglasses on. He couldn't walk very well, even with a cane. He was stuttering with his speech and couldn't come up with his words. He's gone through 24 sessions, and yesterday when he came in, no sunglasses. His speech is nearly completely fluent. He can talk without a lot of hesitancy, and he's more steady on his feet. And he even comments, he's like, it's remarkable. I said, I wish I would have known about this sooner.
What was the application that helped
He's
him?
doing the red light therapy and the PEMF, the whole protocol. He's even doing the exercise. You can't do the exercise portion of it, but you can do the oxygen therapy on a vibration plate and get a similar result. And that exercise with oxygen therapy is like a hyperbaric chamber. So again, energy by a different means.
He's doing just those?
He's also doing the therapies that we prescribed, the physical therapy, the occupational therapy,
Well,
and
sure.
I got him to new glasses, but actually seeing improvements in those things because he's doing the red light and the PEMF and everything.
Without this, what are the other paths that, let's say, a more old school approach
Mm.
would be doing? What are they doing?
Old school approach, we send people to physical therapy, maybe some occupational therapy, maybe some speech therapy. They probably get a neuropsych test along the way just to see what kind of cognitive issues they have. But again, that just goes back to speech therapy. And then if you have a headache, we're looking at medications,
Hmm.
going through the gamut of medications trying to treat that headache. We're not looking
Wow.
at why do you have the headache? How do we get rid of it?
Wow. It's just unreal. So if somebody comes in with this head injury, typically outside of the energy therapy approach, it's let's just get you to, like you said, speech or physical or occupational therapy to help and sort of hope that
Mhm.
this improves. That's it.
Mhm. Yep, pretty much.
And if it does,
And
it does. If it doesn't, it doesn't.
yep. And so many providers will tell their patients, again, what we see at a year, then it's done. If you don't get any better, then there's no real hope of doing anything else. And I can also say that we can introduce red light therapy at any point and you'll still have benefit. It's not going to be as dramatic as it would have been immediately, but you'll still have benefit. All of the research shows that it still works regardless of what time frame you start it. Just the speed varies.
If the person listening either themselves or has a friend or a family member that could benefit from this, where do they start to look if it's not clear and
Mhm.
introduced in their angle?
hmm Sometimes if they can get to a functional provider, those functional providers will be aware, whether it's a functional neurologist, functional medical doctor, functional nurse practitioner, nutritionist, whatever. If they have it in their area, they might be knowledgeable about it. Sometimes that traditional medical provider might tell them as well, but otherwise, you can also look in your area. There's not a lot around the United States, unfortunately. There are some
Really?
places that are more expensive than others. Some are incredibly expensive, and some are not as much. But the thing to know about these is they're all going to be out-of-pocket expenses, unfortunately, because they're not a food, they're not a drug.
Mm.
So the FDA doesn't really deal with them and they compete with medications because if you're doing these things, you might not need those medications. So it's harder to get support for that reason. So you have to be willing to maybe pay a little bit extra for that treatment, but knowing that the money that you're paying for that versus the money that you're paying for those traditional treatments that aren't working is going to be better spent.
Mm. The concussion angle that you brought into the clinic, are there, as far as you know, are there other following suit around the land?
Not a lot. I am in so I'm in the Twin Cities area. In the Twin Cities area, I'm pretty much the only one doing what I do. Most of the other concussion specialists are still kind of doing the traditional route. They might be looking at some of the more supplement type of things, but they haven't really gotten into the red light and other things. Occasionally, you'll find somebody who's a little bit more open-minded, but in the Twin Cities area, I'm kind of it. So we joke that I'm a bit of a unicorn right now.
And a hero to some, I'm gathering. The idea of getting this assistance there, you then also you work with other providers. What angles do they have that the surrounding supportive system also uses these protocols?
Yeah, so there's a lot of different surgical groups that are now sending their patients to that red light therapy center based on conversations with the surgeon that started it. Yes, it was a surgeon, not just any physician. So there are some surgical groups that are sending their patients that way. Outside of that, I also utilize a huge network of other providers that I've gathered, whether it be the neurofeedback acupuncture, neurooptometry, all the different ways to cover outside of our physical clinic
Yeah.
so that I can make sure that patients have everything that they need. And I like to personally meet with all of those people so I know who I'm referring my patients to, so that when I refer, I can say, you know what, I really trust this person. You're going to get good care.
When you see this sprinkling out and getting adoption further with the results, does this give you hope that what's down the road for us?
Yeah, I think it's a really exciting time to be in brain injury treatment at any aspect. Every time I gather a new person into my network and we talk about all the things that I'm doing and they hear about how I'm helping the patients, referring them out to things like the red light therapy, they get intrigued and they start looking into it. And then as I connect with people, everybody just gets really excited. So it's fun connecting with other people who are like-minded and just as excited to see this expand and grow as I am. Because the more I get people energized about it, the more they look into it and the more they actually start researching it on their own and saying, is this something that I want to send my own patients to?
Hmm.
So it's exciting to see that intrigue grow and that curiosity grow. I've been very active on LinkedIn, and people are starting to be active in the conversations and chime in and say, "Yeah, I've had experience with that too." And every time you see somebody else say, "Yeah, I've had experience with that too," or I have had patients that have benefited from that, it just makes more people curious.
I know that some of the resistance, as you pointed out, is for, it's just not what I learned. I'm not gonna look into it. But then also we have to have the very real part of the conversation with the pharma companies and the FDA. Is that true? Is there an adverse, and is that just always going to be the case?
I don't think it will always be the case. The example I like to use is think about when we first started talking about acupuncture years ago. Most of the acupuncture treatments were not covered by insurance. And now, 2025, there are insurance companies that cover acupuncture. So I think at some point we will get insurance coverage for things like red light and PEMF. I don't think it's going to be anytime real soon because we need to open doors, have conversations, get people willing to listen to these things. But I think our medical culture is shifting. People want more options. They want more natural things. They want more ways to treat the problem rather than putting a band-aid on it. So I think there's going to be enough demand for people asking for it that eventually it will get covered. I just don't know when.
But there is a tipping point at some point that
Yeah.
with more adoption, it's just inevitable.
Yeah.
Okay. And your brain wellness solutions business, which also encompasses your brain wellness podcast.
Mhm.
Tell me about that. What is that about?
Yeah, so I started it because I wanted to educate more than just in the walls of my facility that I worked at. So, hence starting the podcast, trying to educate as many people as possible. My listeners are definitely growing on a regular basis now that I'm, again, more active on LinkedIn. So, getting more people in the conversation. But I'm available for other podcasts, for presentations, and I try to do as much education as possible with that. So, it's really more of an educational service. I thought I was going to start by doing some coaching with people, and it just didn't work to coach and have a full-time job. Uh, and I really, really enjoy my job seeing patients on a day-to-day basis. So then that's when it morphed more into the education. I've published a couple of books under it. I intended to do a whole series on different neurological concepts and then got in my own accident. So the
Hmm.
series got put on hold. But I still do a lot of talking, a lot of education. I've done some guest blogging just to, again, get the word out using my expertise that I've gained over especially these last couple of years, but in my 25 years total in healthcare.
25 years. Wow.
Yep.
I know today we focused on, in terms of the energy therapy, we really focused on red light therapy and PEMF, which in and of itself comes in a variety of forms. Is there any other categories we should give a shout out to in the energy therapy circle?
The red light therapy is the big one, and to be a little bit more professional with it, we call it photobiomodulation. So that's the big word. So if you don't see red light, you might see photobiomodulation. That's the term that'll probably show up in the research that you're looking at. So that's kind of the biggest one. The PEMF, also that really high up there. Kind of energy related is that exercise with oxygen therapy, which is a similar thing to hyperbaric treatment. So, hyperbaric, we used to think of years and years ago, people sit in a chamber, they get high dose oxygen pumped into their body. They've got to be in there for 90 minutes or more to get a treatment. If you do some form of exercise with oxygen therapy on it, it's a 15-minute treatment, and you're getting the equivalent of that 90 minutes in a hyperbaric chamber because you're actively pushing the oxygen into your body. That works by excuse me, improving people's energy as well, improving the healing, pulmonary diseases, so lung issues, brain issues, all of those improve when you get better blood flow. So by creating that, that also gives another space for healing. That the clinic here in Minneapolis that does the red light, the PEMF, also does the EWAT. There are other places that do it also.
Really cool. Mandy Dickey, a nurse practitioner with Minneapolis Clinic of Neurology, also the founder of Brain Wellness Solutions and the podcast under the same name, Brain Wellness Podcast. What is the message, Mandy, for perhaps the listener that is looking for relief, either for themselves or a loved one, and also to the medical community? What do we say?
I think number one would be a message of hope. People always think that they get to a point where they can't get better, or they've been told that this is what they're going to be forever. And I always tell people when they come see me the first time, you're not always going to be like this forever, because there are other options that we can look at. And if you don't have a provider that knows about those options, look for one that does. Ask for another opinion. It's not a bad thing to ask for that, because you need to advocate for yourself or your loved one, whomever it is that's dealing with the injury. Advocate for that, ask for different people, look around, see who's doing different things. And as the provider, I would say be open to these different types of treatments, because they work. It's a different type of treatment than we were taught in school, but it really gets down to the why, the root cause of what's going wrong with your body, decreasing the inflammation so that we don't need all of those Band-Aids, the medications to treat the symptoms. We're fixing the problem at the bottom level. And that's the really exciting part about it. So as a provider, we need to be open to that.
Absolutely, really great. I'm so excited that we crossed paths, that I got to know you from your professional standpoint. Really, really important. Thank you so much for doing what you're doing. I see how valuable it is to the people.
Of course. Thanks, Josh, for having me. This has been awesome. I've been so glad we connected as well.